I'd like to welcome you all to the ribbon cutting of our emergency room expansion. We have a few people that would like to make some comments and give some thanks, and so we're going to keep it moving. I'm going to turn it over to Tim McKibbett, our Senior Vice President, and oversees the emergency service.
There's one particular medical staff member that I'd like to thank, and really was his passion and commitment that got the project focused and on track and completed, and that's our medical director, Dr. Rick Barney. And it's because of his passion and commitment that where we're standing today, and the efforts with his group from Southern Wisconsin Emergency Associates, that the project is what it is. So a lot of our credit goes out to Dr. Rick Barney. And it really did get tested. We were done with the project last about June 22nd, and on July 4th we knew we'd have a busy weekend. We see normally about 100, we saw 140, upwards of, and that's 40% more than we see on a regular basis. And the staff did a wonderful job. Thank you all, and I'd like to turn it over to Dr. Barney, and once again thank you for your efforts, and talk a little bit about the benefits of the project.
Not the facility, not a brand new building that we built, which you're going to get to see and have us explain shortly. But we also looked at all the patient encounter procedures from when a patient first presents to the emergency department to when they leave, as far as ordering tests, getting people upstairs quicker. We looked at every single part of that process when a patient's in the ER to make it as efficient as possible. So we've increased efficiency along with building this emergency department, and we have a lot of surge capacity now. We have a state-of-the-art radiology suite, first of its kind in the United States, all digital x-ray room, and then we also have a CT scanner just for emergency patients, which you'll be able to see, something that I felt very strongly about that we were able to get accomplished, so we can get imaging very rapidly. It's all digital, it's PACS, so we can share it amongst doctors at the clinic and anywhere in the healthcare system. And as soon as they take the x-ray, I can look at it, literally 10 seconds later. So there's no films, no delay. We also have monitored beds really in the entire department. So we have 27 rooms, all monitor capable. The monitors are state-of-the-art and can do end-tidal CO2, capnography. They can watch EKGs continuously for changes in heart attack patients. So they're very up-to-date monitor systems.
All of our rooms open up, they break down so that we have more access, able to get more equipment in there if necessary. If you notice, there's a cardiac monitor next to the bed. There's also bedside computers in all of the rooms so that we have access to chart at the patient's bedside. Over here is our tube system, which is what they were explaining, and it's exactly like a bank. You can put your specimens in here. Pharmacy can also put their medications in here, and we can send it right into the tunnel, and we get it back within minutes.
Say an MRI to another facility or something, you get it on
Are any of these rooms specialty rooms, or are they all pretty much equally equipped?
In this section, they're all equally equipped. Now, in the next section, you'll see that we do have a couple of specialty rooms. We have an ENT room that has a chair, not a bed, and we also have 2 trauma rooms that are a lot larger and have equipment available for emergencies.
Okay.